been here, we've seen an increasingly desperate situation unfold. When I was reporting last from this region in Guinea a couple of months ago, we were talking about people not believing in Ebola, not really thinking it exists, not knowing the signs and symptoms, and therefore not taking people to be treated at treatment and isolation centres. What we've seen since then, what I've been seeing in Freetown in the last few days, is that people do understand Ebola. They now know how deadly this thing is. But when they take their loved ones into hospitals, into treatment centres, they are being turned away because there simply aren't enough medics, aren't enough beds to deal with them. I spent the day at Connaught Hospital here in Freetown, where I spoke to British doctors helping to deal with this outbreak.
Suiting up for yet another day on the Ebola front line. Dr. Oliver Johnson has been dealing with this outbreak since it first started. But the isolation ward here at Connaught Hospital in Freetown is overwhelmed as the number of cases continues to rise rapidly.
About a month ago, the WHO said there might be 20,000 dead, and at the time I thought, impossible. It can't be possible that there could be this many deaths. Now 20,000 seems like nothing. And suddenly people are talking about, worst case scenario, more than 1 million deaths in West Africa, which is just, for those of us who thought at the beginning maybe this will be 100 or 200 cases, it's mind-blowing. We could end up seeing more cases a day than we have seen in total in the last 6 months. What's remarkable is that a lot of patients come in and you come in the morning and they are talking, they're a little bit weak and they're a little bit tired, but they're talking okay, and then by the evening they're pretty confused and pretty frustrated, and then by the following morning you come in and they're dead. And within 24 hours, you go from, this person you started to get to know and you think might make it, to this very rapid confusion and exhaustion and deterioration. And it's pretty difficult, I think, for all of us, all the health workers here, day in, day out, to be seeing so many patients who are dying. Really close friend of mine, it was a nurse here who's been an amazing nurse at this hospital, to put her in an ambulance and to close the door and know that, at that stage, there was really no chance that she was going to survive. These are enormously challenging moments, and I think when you're here in the thick of it, you can, you're so busy and you're so involved, you can put this to the back of your mind. But it's really when you have those days off or go back on leave that you start to revisit it. And I think for all of us, it's going to take a heavy toll, and we take that very seriously as a team to make sure that we're all talking about it and reflecting on it and prepared for it.
Well, what we've been seeing in the last few weeks is a much more concerted international effort. We spent some time at the British facility just outside Freetown, which is currently being built. It's a 92-bed facility that will be ready by the end of the month. But what international health organisations on the ground here are saying, what the government here is saying, is that they need medics, they need more bed, they need more money and resources now, not in a few weeks' time. They need it now, because they say the window of opportunity, as we've been hearing, to control this outbreak is now closing.
Sheila, thank you very much indeed.